in your department, like what do you think is the main difference between working in operation theater back in India and out here in the UK? So what are the major differences, and are you even satisfied in this role as of now? So if any of my audience they want to be a OT nurse in the future, what would be your most helpful tips for them? So let's talk about the shift pattern. In my department, usually we start from 7:30 till 8 o'clock. So how is it in your OT department? Salary hota hai because of the nights and the weekends. What about in your department? What about your on-call duties?
So हर रोज एक इंसान ट्रॉमा और ऑर्थोपेडिक्स में ऑन कॉल होता है, जिसमें कि अगर रात में 6 बजे के बाद अगर कोई केस आता है करने को, तो दैट्स व्हेन दे कॉल द ऑर्थोपेडिक का ऑन कॉल इंसान.
Hi everyone, I'm Alicia.
Hi, I'm Janet.
And today in this video, we both are going to discuss about Operation Theatre Nursing. So we both are nurses in the NHS in the UK out here. And जैसे कि मैं cath lab में काम करती हूँ, and in this channel I have entirely covered all the things regarding cath lab, but today in this video I thought, since my friend is from the OT department, we'll talk about it. And basically in this video हम discuss करेंगे कि operation theatre nursing India and UK में क्या differences होता है, salary packages, and what are the different jobs and roles and responsibilities as well, because इधर पे different department का शिफ्ट पैटर्न से लेके जॉब रोल्स एंड रिस्पॉन्सिबिलिटीज एंड इवन द सैलरी भी बहुत डिफरेंट होता है. सो इफ यू आर इंटरेस्टेड इन दिस, सो यू कैन वॉच दिस वीडियो टिल द वेरी एंड. सो लेट्स गेट द वीडियो स्टार्टेड.
Basically, I started when I did my GNM, which is the diploma in nursing. And then after I passed out, I started working in the same hospital that I studied in. I worked there for about 3 years as a nurse in the operating theatre department. So that's all I've ever known. So the operating theatre is what I love to do, and that's all I've worked in. So I worked there for 3 years, and then I decided that it's time to like progress and probably get some exposure in the NHS. Did the whole processing, gave the interviews. My interviews also around the operating theatre. So they asked me if I was interested to do something in the orthopedics specialty. So that's when I got hired as an orthopedics and trauma scrub nurse, and that's how I ended up in NHS.
That's really nice. So आपने like before you started your journey in the NHS, did you work somewhere in India before? Like did you have a nursing experience back in India?
Yeah, I did. I worked in 3 years in India, in Delhi, in one of the hospitals in Delhi, as the same role,
Okay.
scrub nurse, but that was like all the departments included, not just any specialty. So I did a lot of other departments as well.
So did you feel like your experience back in India was helpful for you to work in the NHS?
Yeah, absolutely. क्योंकि इंडिया में I did not just orthopedics, बहुत सारे other departments as well. So it was much more helpful because I knew the cases, I knew the concept of whole, क्योंकि मैंने 3 साल काम किया, and it's like enough to know about like scrub nurse and circulating and the operating theatre department. इसलिए so it was easier. Interview में भी देना, it was easier because it was about the operating theatre.
So that sounds really fair. So the most important question, are you satisfied in your department? Like what do you think is the main difference between working in operation theatre back in India and out here in the UK? So what are the major differences, and are you even satisfied in this role as of now?
Yes, I am absolutely content and satisfied abhi ke liye, because I started working just in 2023. So it's been just over a year. और फिलहाल तो I am very satisfied with what I'm doing, क्योंकि अभी I get to learn a lot more, and it's because it's a specialty, just trauma and orthopedics that I do. So it's a very vast field, जिसमें कि we get exposed to a lot of different operations जो हमने इंडिया में नहीं किए थे, ना देखे थे, सिर्फ सुने थे. तो यहाँ पे आके अच्छे से exposure मिला है, सीखने को मिला है, team work better है. Not throwing any shade at the hospitals in India or anything, but it is obviously much more better for me personally working here and getting the exposure that I know I needed.
So let's talk about the shift pattern. In my department, usually we start from 7:30 till 8 o'clock. So how is it in your OT department?
In our theatre, because it's trauma and orthopedics, it's not emergency. Emergency के लिए हम लोग सिर्फ trauma करते हैं. So we start at 8 o'clock in the morning till 6 o'clock. That is our working hours हमारे लिए. But जो general theatres हैं, they run around the clock.
Okay.
So they have night shifts, they have late evenings as well. and they have the regular 8 to 6 as well.
Okay, so in case if you fall sick, so what like are your department like flexible, like in case if some of the people they fall sick during the shift hours?
Yeah, they're very supportive here. That's one good thing about NHS कि अगर बीमार है तो ऐसे ज़बरदस्ती काम नहीं करवाएंगे ऑब्वियसली. और सिक लीव्स के लिए भी काफ़ी फ्लेक्सिबल है. लाइक जेन्युइनली अगर कोई बीमार है तो दे आर वेरी अंडरस्टैंडिंग.
ऑलराइट, सो व्हाट अबाउट योर ऑन कॉल ड्यूटीज?
सो हर रोज़ एक इंसान ट्रॉमा एंड ऑर्थोपेडिक्स में ऑन कॉल होता है, जिसमें कि अगर रात में 6 बजे के बाद अगर कोई केस आता है करने को तो दैट्स व्हेन दे कॉल द ऑर्थोपेडिक का ऑन कॉल इंसान. वरना वो जो जनरल थिएटर्स हैं वो लोग जो नाइट में रहते हैं, अगर कोई केस रात में आता है एंड इफ द जनरल थिएटर्स कैन हैंडल इट दे टेक केयर ऑफ इट एंड दे विल ओनली कॉल ऑन कॉल trauma and orthopedics if it's really necessary.
All right, and I feel like same in our department, for example, if we get called out middle of the night, there'll be a cab booked for us. Yes. So it's gonna be the same for you, right?
Yes.
Okay, so and जो cab का जो fares होता है, it will be like taken from the budget of the NHS, right?
Yeah.
Okay, and what about the salary? Like as we all know, like every department in the NHS, even though we are in the same band level, band 5 ही है, but different department में different salary होता है because of the nights and the weekends. What about in your department? How is the salary like compared to the ward or the ICU?
आई थिंक ऑब्वियसली क्योंकि हमारे पास एनहांसमेंट्स की अपॉर्चुनिटी नहीं है, क्योंकि हम लोग रात में नहीं रन करते थिएटर, तो हमारे को एनहांस नहीं मिलता है. वी ऑब्वियसली गेट द बेसिक पे, बट वी डू गेट टू डू वीकेंड्स, जिससे कि थोड़ा सा सैलरी में एनहांसमेंट आता है. एंड समटाइम्स वी कैन डू ओवर टाइम एंड दैट्स व्हेन ऑन कॉल्स ऑफ कोर्स. अदरवाइज वी गेट पेड द बेसिक डे.
Okay, so I think basically that's a major drawback of working in specialty, which doesn't run at night time. For example, in cath lab, endoscopy, and even in your OT department. But some of the OT department they do run at night, but it's just in our hospital we don't do at night. And like that is a major drawback because night का इधर पे extra enhancement होता है in the NHS. But I think it wasn't there in India, right? Night shift, we didn't have any enhancement in India.
No, India did not have any enhancement.
Yeah, even same in my department. I used to work in ICU, तो अगर हमारा नाइट शिफ्ट भी कर रहे हैं, हमारा सैलरी स्टैंडर्ड था एंड कोई इन्हांसमेंट नहीं होता था नाइट का. बट देन आउट हियर अगर आप वार्ड में काम कर रहे हो या फिर यू आर वर्किंग इन ICU, तो अगर आप नाइट शिफ्ट करते हो तो उनका इन्हांसमेंट होता है. बट just because हम लोग नाइट में ऑपरेट नहीं करते, but it's just the on call nurse who will be present night time को if there's an emergency case. तो थोड़ा सा वहाँ पे हमारा सैलरी थोड़ा सा comparatively down हो जाता है compared to the ward and ICU. And what are the career development opportunities in the OT department?
So the career development is pretty good, I would say. जैसे इंडिया में OT टेक्नीशियंस अलग होते हैं एंड नर्सेज अलग होती हैं. जहाँ पे मैं काम करती थी वहाँ पे अलग होते थे. बट इधर यू कैन ऑल्सो क्वालिफाई एज एन ODP which is usually funded by the hospital. अगर उनको you have to like apply and if it's funded by the hospital तो तुम scrub practitioner with ODP बन सकते हो, which is still a band 5. You can apply for it. But that's, I think it's not just about the money, it's about the professional growth and like knowledge that you would probably gain from it. तो उसमें और ज़्यादा एक्सपैंड हो जाता है हमारा अप्लाई करने के लिए. अगर इस ट्रस्ट से किसी और ट्रस्ट जाना है या रोल्स में एक्सपेंशन होना है तो दैट इज़ रियली हेल्पफुल वन. और दूसरा देयर इज़ लाइक अ लॉट ऑफ CPD फंडिंग अवेलेबल फॉर हर ट्रस्ट में होता है. लाइक दे कैन फंड देयर स्टाफ टू लाइक प्रोग्रेस इन लाइक ट्रेनिंग्स एंड लाइक स्टफ लाइक दैट. तो अगर किसी ने अगर डिप्लोमा करके आया है नर्स बनने के लिए तो वो लोग फंड करते हैं फॉर डिग्री टॉपअप. तो जैसे इंडिया में पोस्ट BSc होता है, यहाँ पे डिग्री टॉपअप होता है. इट्स फॉर लाइक डिपेंड करता है कि कैसे करना है, ऑनलाइन ऑफलाइन. तो हॉस्पिटल इज विलिंग टू फंड इट. वो है. एंड देन द हॉस्पिटल ऑल्सो सेंस लाइक आवर हॉस्पिटल सेंस फॉर डिफरेंट ट्रेनिंग्स एज वेल. लीडरशिप प्रोग्राम्स हैं और एजुकेशनल प्रोग्राम्स हैं जिसके लिए हॉस्पिटल फंड करके भेजता है यूजुअली.
सो बेसिकली लाइक अगर हम इंडिया में जस्ट GNM नर्सिंग करके आए हैं एंड अगर BSc नर्सिंग करके आए हैं एंड इफ आफ्टर कमिंग हियर वी आर लाइक इंटरेस्टेड कि हमारा डिग्री और ज़्यादा हम क्वालिफाई करें, फॉर एग्जांपल फ्रॉम GNM इफ़ यू वांट गो फॉर पोस्ट BSc, और अगर हमने BSc किया है एंड इफ़ यू गोना गो फॉर मास्टर्स देन वी कैन अप्लाई फॉर इट. एंड अगर आपके हॉस्पिटल में बजट है, फर्स्टली यू नीड टू स्पीक टू योर लाइन मैनेजर there's a process and there are various steps, right? So in case like if you get the funding approved, then finally you can go for it, and hospital is gonna pay, and there's only a certain amount from our side that we need to pay, which is like comparatively good, that we don't have to pay 100% of your education qualification fees. It's just half se zyada, almost like 70% of it is covered by the trust, and just remaining 30% हम खुद अपने salary से हम pay करते हैं, and which I find it's a very good deal. So I feel जो fundings by the NHS Trust है for the nurses and for other staffs out here for their own career growth is really good. So if any of my audience they want to be a OT nurse in the future, what would be your most helpful tips for them?
I think they could have like standard knowledge about sterility, theaters, and अगर कोई ऐसा field of operation है जिसमें उनको interest है, जैसे orthopedics, gynae और न्यूरो ऐसा वाला, तो जस्ट हैव लाइक बेसिक नॉलेज, इतना ज़्यादा वेल वर्स्ड होने की ज़रूरत नहीं है. एंड सेकेंड, बिकॉज थिएटर इज़ मोर टीम बेस्ड एनवायरनमेंट, हर चीज़ टीम में होता है. इट्स नॉट एन ऑटोनॉमस वर्क. जैसे कि वार्ड में तुम्हारे पास अपना पेशेंट है, अपना फाइल है जो तुम्हें कंप्लीट करना है, यू आर डूइंग योर ओन थिंग, यू टेकिंग केयर ऑफ योर ओन पेशेंट. बहुत ही टीम वर्क वाला काम है. सुबह ब्रीफ होता है, यू हैव टू बी रियली कम्युनिकेटिव. तो आई थिंक यू शुड लाइक वर्क ऑन योर, be really good at communication, work on your communication skills, your teamwork, and that's really important to me. I think communication solves most of the problems in healthcare as well.
Yeah, I think that's very important, because like unlike in the ward and in the ICU जहाँ पे like we are the in charge of our patients, क्योंकि हम like we are the one who decides every day the plan of the day, but out there in the like OT department, and similarly in the cath lab also जहाँ पे multiple there's a like multi-professional department, सारे काम कर रहे हैं एक साथ, तो वहाँ पे team work and like communications बहुत important होता है, because even if थोड़ा सा भी miscommunications हो जाए, the entire plan of the day gets affected. So we should be very clear in our communications, and most importantly like how we are gonna express ourselves. Like if you need some help or if you want something to be sorted out, तो हमको जैसे हम किसी को कैसे request करते हैं, I think it is also very important, right? So can you share some NHS interview tips to our audience that would be helpful अगर कोई NHS में as an OT nurse try करना चाहते हैं तो?
पहली बात तो just try to be confident, be very presentable. Go through the NHS values and their objectives of NHS, और जिस भी trust में तुम apply कर रहे हो, go through them, go through their hospitals. Like अपना hospital choose करो जो तुम्हारी priority list है. Like be sure कि तुम्हारे को क्या करना है in the future. Be polite, be nice to the interviewers. Usually they are also very nice to you. They'll make sure you're comfortable. ठीक है. अगर कुछ समझ नहीं आ रहा है, the questions they're asking, if sometimes, because sometimes it happens with me as well, with everyone, कि accent समझ नहीं आता है, maybe they do not understand our accent, so just be nice and like just ask them to repeat it, or if they ask you to repeat it, just be really clear about it. क्योंकि usually NHS अगर इंडिया में interview ले रहा है तो it's over the video call, तो make sure first your internet connection is solid.
Yeah, very important part.
Make sure you're presentable, and be honest about your experience, be honest about your knowledge, जितनी है ज़्यादा है, just be completely polite, honest, just be nice, be easygoing.
I think like to maintain your presence of mind and maintaining calmness is very important during the interview. And like you said, the internet connections वो बहुत matter करता है, because वो हमारा video call के through होता है, and if your internet connection is not good, then it's gonna be a like very like अच्छा इंटरव्यू नहीं जाता है. सो देयर बी लाइक कट, एंड मोस्ट इम्पोर्टेंटली नॉइज एज वेल, जहाँ पे हमको पता है कि जस्ट मेक श्योर लाइक अगर आप इंटरव्यू दे रहे हो, मेक श्योर द एनवायरनमेंट हैज लीस्ट नॉइज, क्योंकि अगर बैकग्राउंड नॉइसेस इतना ज़्यादा शोर शराबा है तो देन देयर विल बी लॉट ऑफ प्रॉब्लम्स ड्यूरिंग द इंटरव्यू. सो मेक श्योर दैट योर इंटरनेट कनेक्शंस एंड योर एनवायरनमेंट इज काम एंड पीसफुल.
जस्ट इमेजिन कि इंटरव्यूअर इज एक्चुअली इन द रूम विद यू, कि वीडियो कॉल नहीं है, दे आर एक्चुअली देयर विद यू.
एंड जानेट लाइक डू यू थिंक लाइक जो हमारा previous experience based on that the NHS is giving us the vacancies in the hospital, or do you think that it really matters? Like for example, you worked in OT, but then I think you stated that you want to work in OT department, right? I did not have any background of cath lab, but then उन्होंने मुझे cath lab में मुझे डाल दिया. So I feel like irrespective of us having a nursing experience, yeah, NHS is demanding nursing experience, but it's not like very sure that आप जिस department में आप पहले इंडिया में काम कर रहे थे, they will just give you the position in the same department. It's based on NHS vacancy, जहाँ पे वहाँ पे spot होगा, वहाँ पे आपको मिलेगा. So Janet, how did you prepare for your exam? Were you working when you were studying for all this exam, और आपने like job छोड़ दिया था to prepare for the UK processing?
नहीं, I was preparing for it while I was still working in India. मैंने OET के लिए कुछ 1 महीने की कोचिंग ली थी, फिर मैंने OET एग्ज़ाम दिया था. देन जहाँ से मैंने कोचिंग लिया था उन लोगों ने मेरे को थोड़ा PDF टाइप दिया था CBT प्रिपेयर करने के लिए, which is the next step after OET. तो उसको फिर मैंने CBT दिया था while I was still working in India.
So thank you, Janet, for sharing all the information. I think it's very helpful for all the audience who want to be an OT nurse in the UK.
Thank you so much for having me.
I hope you had a good time with me.
Did, thank you.
Yes, and guys, don't forget to subscribe to my channel if you haven't subscribed yet, and you can like this video and you can comment down as well. And if you want, you can see my other videos as well, jo I feel like it's useful for all the nurses who wants to come to the UK. So guys, thank you and bye bye. Take care.